Okay. Good afternoon. My name is Leela. I'm working as a gynecological oncologist at KIMS Icon Hospital, Sheelanagar, Visakhapatnam. Today I'm going to enlighten you all about cervical cancer. Actually, I have divided my talk into three parts. First part, I'm going to talk about what exactly the cervical cancer is and what are the risk factors, what causes cervical cancer, what are the symptoms, signs, and treatment. More than that, what one has to know is how to prevent cervical cancer. So, in these two important aspects, I'm going to cover. One is vaccination, the other one is screening for early detection of cervical pre-cancer. So first we will know a little bit about what exactly cervical cancer is. So cervix is the first part of the uterus. In the common language, it is called as neck of the womb. If cancer develops at the cervix, we call it as cervical cancer. This is actually the fourth most common cancer in women worldwide, whereas in India it is the second most common cancer after breast cancer. The saddest part is we see more cervical cancers in women of the rural origin compared to the urban origin. And again, when you talk about the world statistics, we see two-thirds of the cases in underdeveloped and developing countries. So coming to India, every year we see about 1 lakh new cases of cervical cancer. That means about 1 lakh women being diagnosed with cervical cancer. Again, majority would be diagnosed in advanced stages. And with this cancer, we lose about 60,000 of women annually. So that is an alarming figure because it is a cancer which has to be prevented. Then what actually causes cervical cancer? So it's proven beyond doubt that a viral infection, which is called as human papilloma virus infection, is responsible for causing cervical cancer. So how does a woman get this viral infection into her body? Coming to the risk factors, first we will know the risk factors, then we will know how the HPV infection enters into a woman's womb. The risk factors are early marriage. So if you go to the rural areas, still many girls are married by the age of 15, 16, even though the age limit for marriage is set as 18 years. Second thing is by the time they get married, they start their sexual activity and start producing children. Even though they stop after 2 or 3 babies, but still early marriage and starting sexual activity at early part of life is considered to be the major risk factor. Apart from that, smoking and alcohol can aggravate. Then other risk factors are promiscuous behavior of both men and women. If women has multiple sexual partners or men themselves having multiple sexual partners can also increase the risk of cervical cancer. In addition to that, women who have low immunity, that's called as immunocompromised, or women who have low resistance in their body, like women with human immunodeficiency virus, that is HIV virus infection, are those women who have got blood cancers, are those who had kidney transplants. They're all at a higher risk compared to normal women in getting cervical cancer. So I was talking earlier about this HPV infection. So this viral infection is transmitted from men to women and women to men through sexual activity. There are many varieties of HPV viruses. There are more than 100 viral infections. In that, they are divided into three groups: low risk, intermediate risk, and high risk types. So those HPV viruses of high risk type are considered to be responsible for causing cervical cancer. In that, HPV 16 and 18 is considered to be the major causative agent for more than 90% of cervical cancers. Even though the virus infection enters into the body through the sexual activity, 90% of women clear by the time they reach 30 years of age. So the good news is, even though the viral infection enters into our body, it won't remain with us for a very long time. But those women who continue to have this high risk HPV virus in their body beyond 30 years of age are at risk of developing cervical cancer. What one has to understand is the cervical cancer doesn't develop overnight. It takes years. So just for an example, if a girl gets married at the age of 15 or 20, and if the virus enters into her body, and if she doesn't clear by the age of 30, so maybe next 10 to 15 years, she will develop cervical cancer. So that means by the age of 40, 45, she will be having a risk of getting cervical cancer. So we have a long window period where we can do a good screening to see a woman is at a risk of getting cervical cancer or not, which I'm going to discuss a little later. So coming to the symptoms of cervical cancer, the commonest symptom what we see in women who are attending to our outpatient department is, apart from their regular menstrual cycles, they do have intermenstrual. That means in between the cycle, they'll have bleeding or sometimes contact bleeding in the form of bleeding after having sex, or when the doctor is trying to examine, also they'll have bleeding. Apart from bleeding, they also come with excessive white discharge, which is often smelly, itchy, or sometimes it is blood stained. If these symptoms are ignored, or if the woman continues to have an advanced disease, they do have urinary symptoms, they will have difficulty in passing the stool, and ultimately they even lose weight because of the spread of the disease to other parts of the body. So how to diagnose this cervical cancer? So as soon as a lady has a doubt about her menstrual pattern or excessive vaginal discharge, when she comes to the clinic, the gynecologist examines her using a device called a speculum, which helps to expose the cervix. And by looking at the cervix, one can detect whether there is any suspicious appearance of the cervix, and biopsy will prove the diagnosis. Just like any other cancer, this cervical cancer also has 4 stages. In the first stage, it is usually confined to the cervix, whereas in the second stage, it starts spreading to the neighboring parts. In the third stage, even to the neighboring structures like bladder and the rectum. And once it reaches fourth stage, it goes beyond the uterus to the distant parts like lungs, liver, etc. So coming to the treatment, like a standard treatment for any cancer, we have 3 standard modalities. One is surgery, second one is radiation, and third one is chemotherapy. So all these three modalities can be used for cervical cancer based upon the stage at which we diagnose. We diagnose in early stage, that is the stage 1, surgery can be offered, and beyond that, the standard treatment is using a combination of chemotherapy and radiotherapy. Even if it is far advanced, where we can't offer a definitive treatment, then we need to think of giving a palliative care. That means taking care of the symptoms of the woman. So this is in nutshell about cervical cancer, but I want to focus more on preventing the cervical cancer because it is a preventable cancer. And actually last year, November, World Health Organization has given a call for global elimination of cervical cancer because it is a public health problem. So in most of the countries, the incidence is so high that it needs to be brought down so that women can live with free of cervical cancer. So they have given a call for elimination of cervical cancer. So that means we need to have 3 important targets to eliminate the cervical cancer. These 3 targets are: number 1, we need to vaccinate girls, 90% of the girls by the time they reach 15 years of age. And the second target is 70% of women have to have a definitive screening test twice in their lifetime, that is at the age of 35 and at the age of 45. Then the third target is 90% of women who are diagnosed with cervical precancer or cancer need to have definitive treatment. So these three targets have to be achieved by all the countries in the next 10 years. That is, by the time we reach 2030, we need to reach these targets so that the incidence of cervical cancer will come down to less than 4 cases per 100,000. So right now in India, in various parts, we have something like 7 per 100,000 to 27 per 100,000. So our aim is to bring down to 4 per 100,000 in less than 10 years of time. So how to reach these global targets? So how can we do this? So I was talking about vaccination. Vaccination is considered to be a primary prevention. That means to completely eradicate disease, we need to vaccinate. So if you think of a polio eradication or if you think of a smallpox eradication, you know how vaccine has helped to eradicate these two diseases from the world. So likewise, we have a vaccine against HPV virus. As I mentioned earlier, this human papilloma virus infection. To control this, there is a vaccine available in the market for the last 14 years. We have two types of vaccines available in India. One is called as a bivalent vaccine, which works against HPV 16 and 18 virus. Whereas quadrivalent vaccine, that means it protects against 4 HPV types, that is 16, 18, 6 and 11. So all the girls, by the time they complete 9 years, that means from 9th birthday is over, from then till 14th, 15th birthday is over, they need to be given 2 doses of HPV vaccine at 6 months interval. So once they complete 15 years, they need to be given 3 doses of vaccine at an interval of first dose, then afterwards either 1 or 2 months gap, then subsequently 4 months later. So depending upon the type of the vaccine, we choose either bivalent or quadrivalent. So the WHO has strongly recommended that all the girls between the age of 9 and 14 have to be vaccinated. So that should be the number one goal for us. So what we need to do is, if we have daughters or granddaughters, either our own family members, we need to bring them or we need to take them to a gynecologist for HPV vaccination. Like how you vaccinate your children against many infectious diseases, you need to consider this HPV vaccine also as a part of immunization program. So this has actually shown a lot of benefit in many developed countries, and with that they have conclusively proven that the incidence of cervical pre-cancer will come down automatically. Once the pre-cancer comes, the cervical cancer also comes down. So you may be wondering what is pre-cancer and what is cancer. So when you know about the natural history of cervical cancer, it doesn't happen overnight, as I said earlier. It has a predictable pre-cancer stage. That means which can be detected only by test, not by looking at the cervix using our naked eye. So once this pre-cancer develops, slowly it turns into cancer. So all these changes happen over a period of 10 to 15 years. So how to pick up this pre-cancer? So to pick up this pre-cancer, we need to do the screening test. So screening means woman doesn't have any symptoms, but when they see the doctor will do a specialized test to see whether that particular woman has a risk of getting cervical pre-cancer and slowly later as cancer. So detecting or doing a test in asymptomatic stage is considered to be a screening test. So there are now well-proved screening tests for cervical cancer. There are 3 or 4 tests. Previously, we used to do very commonly, very simple test that is called as visual inspection with acetic acid. That means application of acetic acid to the cervix and see whether there are any aceto-white changes, which is very popularly done in community in India. Second is majority maybe in knowing about this bird smear test, that is pap smear test or Papa-Nicolau smear test, where we take this white discharge from the cervix, spread it onto a glass slide and send it to the lab for examination. The cytologist will see whether there are any abnormal cells coming from the cervix which are showing precancerous changes. Now, the latest and conclusively proven useful, highly sensitive test is human papilloma virus test. Because we know the virus is the causative factor, we have the test where we take the same white discharge and put it into a liquid medium and send it to the lab. Then the molecular oncologist will do the test to see whether the cells contain HPV virus infection. So if this test is considered to be quite sensitive test, that means if the test is negative, very conclusively you can reassure the woman that she will not develop any cancerous change in the next 5 years. So these screening tests are ideally need to be started from the age of 30. So 30 to 65 years of age who have intact uterus and who are sexually active need to undergo the screening test every 5 years. Suppose if the test is negative, they will be called only after 5 years. If the test is positive, since the HPV virus test is positive, then the gynecologist would decide what needs to be done. And there is a special instrument called as colposcope. With this colposcope, one can look at the cervix under magnification. And after looking at if there are any changes on the cervix, you can take a biopsy. And based upon the biopsy report, you can do a very simple treatment using a cryo or using a heat just to destroy the abnormal area instead of removing the entire uterus. So this screening will help us to make sure that the lady doesn't have any kind of a precancerous change. Even if she has a change, it can be handled very easily. So this vaccination and screening together will definitely help to reduce the burden of cervical cancer. Already this is happening in most of the developed countries, and Australia is the #1 country where they are going to declare cervical cancer elimination probably in the next couple of years, because they have a very high percentage of vaccination of their children. Usually, most of the developed countries have started school vaccination programs. By the time the girl comes to 6th class, they educate the girl as well as their parents and do the vaccination. And the women there go very regularly to their general practitioner for screening, because they're all given a lot of advocacy and awareness. So what we need to do in our country also, because of our high incidence of cervical cancer, we need to promote these two activities, vaccination and screening. So a lady can go to a gynecologist with her daughter. She can ask the gynecologist for vaccinating her daughter, and she herself can screen for cervical cancer. So these two things together will make our country also free of cervical cancer. I hope I have conveyed some information. If you still need any further information, you can reach me at KIMS Icon Hospital, Sheila Nagar. I do screening very regularly here. I'm here every day in the morning hours. So one can come forward to have a screening, and they can bring their daughters for vaccination. Thank you very much for this opportunity. Thank you.